Hi everyone, my research presentation will be on type 2 diabetes. So the contents covered in this presentation includes diabetes as a whole, the three types of diabetes, statistics, why it's relevant to public health, diabetes trends in the past, ways to improve the numbers, as well as primary, secondary, and tertiary prevention methods. All right, so what is diabetes? Diabetes is a forever long health condition that's developed when an individual's sugar level in their blood increases to levels that are higher than average. The main root cause of this is insulin, which is a hormone that's made by the pancreas and is the main contributor of letting the blood sugar into the cells of your body so that it can be used as energy. However, individuals with type 2 diabetes, their cells don't react to the insulin, therefore the body doesn't use the sugar in the blood as energy, and it gets stored, creating higher blood sugar levels. The pancreas then tries to combat this by producing more insulin to try to get those exact cells to hopefully react. However, ultimately they don't, which is why the blood sugar of an individual with type 2 diabetes is remaining at a constant high. The three types of diabetes includes type 1, type 2, and gestational. However, type 2 is the most common, and it typically occurs in adults over the age of 45. All right, going into more specific epidemiological data and statistics, the prevalence here in the United States with diabetes is 37.3 million, which is equivalent to 11.3%. However, the actual percentage of people with type 2 diabetes I couldn't actually find. However, you could hypothesize that since type 2 diabetes is most common, a majority of this percentage is towards type 2 diabetes. As for prediabetes, it is at 96 million, which is a 38%. Now, as for disparities, Blacks tend to have the highest percentage of diabetes at 24.1% and whites at 15.5%. And for differences in sex, men typically have a higher chance of getting diabetes, and the percentage is at 14.6, while women are at only 9.1. And research has been done to see why men are more likely to have it, and some reasons could be due to differences in visceral mass, because typically women have less mass than men, and it can be due to more fat storage in the belly area. However, it can also be because men are typically more stubborn and usually don't go to checkups in hospitals unless it is a completely dire situation. They tend to wait until the last minute. So this could very well play a role in these statistics. Now going over the importance of diabetes to public health. So as I mentioned before, this disease is very relevant to public health because of how common it is. There is 1 in 10 people that have diabetes, yet there is such a small number of people who actually know that they have the symptoms of diabetes. Now, blood sugar spikes can lead to many other health conditions as well, and it can very easily deteriorate someone's health if it's not being monitored, or for someone who doesn't even notice that they are having blood sugar spikes. Now moving on to diabetes trends in the past. So as our population continues to grow, so do the numbers of individuals diagnosed with diabetes. In the 1960s, only 0.91% of the population had diabetes. And then jumping to 40 years later into the 2000s, 4.4 people of the percent of population have diabetes, which is quite a big jump. But like I said, because the population is growing and there's more food being introduced, not all of it is healthy, and therefore it very well can cause growing numbers of diabetes. As for education, 7.5% of people only had higher education than high school, had diabetes. 9.7% people with diabetes only had high school education, and 13.3% of individuals with less than high school education had diabetes. So it's shown in the statistics that with more school education and higher education, the numbers of diabetes tend to lessen a bit. Moving on to ways to improve the numbers, educating people on this disease would be the best shot because not everyone knows just how serious this disease can be and how it can lead to many other health risks. These people would have to give up certain foods that they love, and it's a disease that you live with forever when it can hopefully be controlled and lessen the chances of an individual getting it. Another way to improve the numbers is implementing a tax on unhealthy and junk foods. And while type 2 diabetes isn't completely lifestyle, it can also be genetic. But lifestyle factors play a major role, and being obese or having just unnecessary amounts of junk food in your body can also increase the chances of getting type 2 diabetes. So having a higher price on certain items may make it less worth it, like make it less worth the price. And instead, the individual hopefully can choose a healthier alternative that isn't taxed. Lastly, going over prevention. So the three types of prevention includes primary, secondary, and tertiary. For primary prevention, they are changes that are made before the development of the disease. So it can be consistently exercising, eating nutritious foods, lessening and controlling the intake of unhealthy junk foods, as well as maintaining a healthy weight, because being overweight and obese definitely changes a lot in your body and can include some negative health effects. As for secondary prevention, it is preventing prediabetes to going to type 2 diabetes. So again, lifestyle changes, lessening sugar intake, and more importantly, monitoring your levels, your blood sugar levels to know whether or not certain foods spike your blood sugar and when your blood sugar actually spikes. And lastly, tertiary prevention includes prevention of diabetes affecting other parts of your body because, again, like I mentioned, it can lead to other health conditions. An example of this is diabetic retinopathy, which is blindness in the eyes that have been caused by diabetes. So that is my type 2 diabetes presentation. I hope you guys enjoyed it.